Hello viewers, welcome to the Learners Nursing classes. Today I will be discussing about the important topics from the medical surgical nursing. ये जो topics हैं ये entrance exam point of view भी बहुत important है और for the students also it is very important and lifelong and for any exams related to nursing these questions are very important related to these topics. See, autoimmune disorders. Like in autoimmune disorders, there are three most important topics like diabetes mellitus. Now, diabetes mellitus type 1 and type 2. Then coming to myasthenia gravis and a connective tissue disorders like SLE and DLE. All these are connective tissue disorders. Then coming to the heart diseases, there are congenital heart disease, cyanotic and acyanotic. Then coming to valvular heart disease, coronary artery disease, angina pectoris, infective endocarditis is also very important topic. ECG related to heart. ECG is very important. Arrhythmias, myocardial infarction. Now, what are the cardiac markers like cardiac enzymes and hypertension? Important topic related to heart disease. In respiratory system, chronic obstructive pulmonary disease, which comprises of three diseases, is very important. Then coming to bronchial asthma, COVID, like the whole era was disturbed because of COVID. So COVID, pleural effusion. Now PFT is also a very short topic, in important topic. Pulmonary tuberculosis, national tuberculosis program. So these are important topics from the respiratory system. Coming to hepatobiliary system, cirrhosis of liver is important, cholecystitis is important, pancreatitis is important, choledocholithiasis, and hepatitis. Like hepatitis means hepatitis, there are various types of hepatitis because of like A, B, C. There are so many, so we should know about it. Then coming to orthopedic arthritis like post-traumatic arthritis or rheumatoid arthritis, osteoarthritis. Now coming to the management, fracture management. What are the in fracture management? Like we should know what is spica, what is plaster, what is traction, what are splint casts, what are posterior slabs. And in complications of fracture, we should know fat embolism, compartment syndrome. What is the management like immobilization, all that. Coming to the urinary system, chronic kidney disease, and stage renal disease. So that will also have transplant, kidney transplant, importance of kidney transplant. Now, acute kidney injury, nephrotic syndrome, renal calculus. These are important topics from the urinary system. Now, blood related, there are important topics related to blood like anemia, iron deficiency anemia, or pernicious anemia, the types of anemia. Then coming to thalassemia, thalassemia major, thalassemia minor, all these. Central nervous system related like meningitis, road traffic accident, trauma, and spinal injuries, head injury. Then coming to GCS like Glasgow Coma Scale. Now types of seizures, status epilepticus, generalized tonic-clonic seizures, cerebrovascular accident. These are related to central nervous systems. Coming to endocrine system or related to the glands like pituitary disorders like pituitary adenoma and acromegaly, hypothyroidism, hyperthyroidism. These are important topics from the endocrine system. Ear, nose, throat, we will have sensory neural hearing loss, then conductive hearing loss, then chronic and acute suppurative otitis media, then some tests like tuning fork test, then Meniere's disease are from the ENT. Coming to the eye, the cataract is very important, retinal detachment is important, glaucoma, retinopathy of prematurity, and in tests like we see, it is a slit lamp test is one of the important tests. Coming to the most important topic, that is burns. In burns, we should know what is burns, what are the degrees of burns like superficial, deep burn, now types of burn, inhalation injuries, electrical burn, thermal burn. Then coming to the distribution of burns like total body surface area, rule of 9, how to distribute burns. Coming to the management में immediate management and after 24 hours management. So that will have a fluid management and caloric requirement management. Coming to the wound therapy, wound management of a burns patient. See, in wound management, it will be cleaning, debridement, dressing, then application of the ointments, application of the emollients, then types of grafts used. So this all will contain the wound management. ऑन्कोलॉजी विल हैव मुझे लगता है कि सबसे इंपॉर्टेंट टॉपिक्स ऑन्कोलॉजी में सी ए ब्रेस्ट है, सर्वाइकल कैंसर्स हैं और लंग कैंसर्स हैं. इफ़ यू रीड दीज, आई थिंक दीज आर इनफ टॉपिक्स फॉर यू related to oncology. Thank you so much. Like, subscribe, and share.